SDEC stands for Same Day Emergency Care. We're looking to treat, diagnose, assess, have a plan of care for patients in the same day. That relieves the pressure then on the rest of the hospital.
So patients who are arriving either through a referral from their GP or by ambulance are referred because they need assessment. People are concerned about some of their symptoms, but with some quite simple tests or treatment, they can be turned around and go home that same day. And so SDEC relieves pressure on that service and means that our MAU can concentrate on the sickest patients that need their support.
We're doing our very best to support patients and create that positive feeling in the unit. Many of our patients say when they come here that it's a calm environment. They feel that they're seen in a timely manner. It promotes patient flow. It provides a positive patient experience, and it gives patients a high standard of care, which is what they deserve when they come to the front door and they're looking for emergency treatment. It's a positive impact on them.